Hey guys. So today we're going to go over chapter 25, which is endodontics, uh, fancy word for root canals. So, endodontics, the subjective portion of the examination includes um, the doctor asking questions like, is it sensitive to hot and cold? Because typically, if the tooth is sensitive to hot and cold, um, then more than likely it's indicating that it needs a root canal. If it keeps the patient up at night, that throbbing boom, boom pain, that's a good indication that there's an abscess, that it needs a root canal. If the patient is swollen, that's a good indication as well. So, and then also too, sometimes when someone chews, that's a good indication. But typically, if it's sensitive to hot and cold and the pain lingers, like, ask the patient, so if you drink something cold or hot, does the pain linger and how long? 5 seconds, 30 seconds. So it just depends on what the patient says. But if it's like 30 seconds, then more than likely they will need a root canal. Then, of course, we're going to always take an X-ray of a toothache patient, someone that comes in saying that their tooth is bothering them. Excuse me. Take an X-ray, and then the doctor also can diagnose from the X-ray whether or not the decay is into the pulp and the patient needs a root canal. All right. That then he also could take a instrument like an Explorer, and say the patient says, "Oh, I think it's this very back one on the bottom." The dentist will tap on the teeth in front of that tooth and ask the patient, does this feel the same as this? And they can test it that way as well. So once they determine what tooth it is that's bothering the patient, sometimes it's really visible on the X-ray. But doing those tests, the tapping on the teeth, also he could put cold on there and see if the patient reacts to that, which typically they do. It doesn't feel very good. They figure out what tooth it is. Then they're going to give the patient the treatment plan saying, hey, this tooth, to be able to save the tooth, we need to do a root canal and a crown. And so if the patient says yes, what the dentist is going to do is he's going to go in there, he's going to get out all the decay, and he's going to expose the pulp. Okay? And then he's going to take these little files, and there are pictures of files on 417. Those are known as K files, hand files. He will start cleaning the infection out from inside the canals. And on 415, you can see the X-ray where the files were in the canals. That is known as a working length X-ray. So we set the room up, and he's doing all this by hand at first. He's doing everything, but he's gonna ask for you to get a working length X-ray. So he'll leave the files in the tooth, and then you'll get an X-ray. Then he's going to call out numbers to you. Say it's 3 canals. He might say the palatal canal is 18 millimeters. The mesial distal canal is 16 millimeters. So he's going to call out numbers and you write them down. That way, if they ever had to go in and retreat that tooth, because sometimes a root canal needs to be retreated, not always, but sometimes it can fail, they know exactly what each canal was measured to, what he filed the canals too. All right. Also, you always, every time he finishes a root canal, you're always going to get a final x-ray, because that gets sent to the insurance company. So the insurance company will pay for the root canal, or their portion of the root canal. So we always will get a final x-ray when the root canal is completed. At the top there of 416, you can see where it's white in the canals. That is where it actually is sealed. So that's a final x-ray. If you look at the x-ray below, look how part of that crown is gone, and see how it's dark and it's into the pulp. That tooth definitely needs a root canal to be saved. Do you see on the sides though that of the crown of that tooth on 416? It looks like a thorn on a rose right there in between the mesial and the distal. It looks like a thorn. That's actually calculus. So that patient also needs a cleaning. So, but that's what calculus looks like. It looks like thorns in between the mesial and distal on the tooth. The picture at the top of 416, that is a abscess. That is a pimple basically on the gum. So what the dentist would do is get a scalpel and I'll cut it. And then all this pus and blood comes out. It's awesome. I think it's awesome. So, but that's what it would look like on the gum. It looks like a pimple like that. And it's full of pus. So the patient, once the dentist relieves that, the patient does feel better, but they still need to have the root canal. More than likely, if they do have an abscess on the gum like that, they're probably going to prescribe antibiotics. Let the patient get antibiotics in their system for about 2 days, and then do the root canal. Only for the simple fact that if a patient has an abscess, when the doctor goes to numb the patient up, the infection will eat up the anesthetic, and so it's harder to get the patient numb. So that's why they want to kind of clear up the infection before they work on the patient, just to keep the patient comfortable, so the numbness doesn't wear off. So I was talking about these files, instruments. And if you look, there's different colors, okay? Those are known as K files, hand files. So he takes them by his hand and he goes in and out of each canal. They are universal color coded. So you could go anywhere in the United States and they're going to be the same color, okay? I know just from doing this for 100 years. The 15 is the white, and typically he'll start off with a 15. Then he might go up to a 20, which is the yellow. He'll leave a 20 or a 15 in the canal, and that's when he'll ask you to get that working length x-ray. Then he'll go up a little bit more. So if you notice, these are 15, 20, 25, 30, 35, 40, 45. They're all in 5 increments. Okay. Now that, the 15, the 20, that is going to be the width of the canal. Files come in 3 lengths, like how long they are. It would be a 21 length, 25 length, 30 length. Okay. 30, that canal, I mean, the root is super long. So very rare does the dentist ever use a 30 length canals, files. So it's typically a 21 or a 25. So, and then depending on when he's filing, what he needs to file to. So it might be a 21 length, but at a 35 width. So once he gets everything cleaned out, when he's filing, get the infection out, he's going to ask you to irrigate. So you're going to get a syringe, and you're going to fill it up with part bleach. Yes, I said bleach. Part bleach, part water solution. Fill that up in the canal. I mean, in the syringe, and then he's going to stick it in the canal and irrigate and flush all that debris out of the canal. So if he says, "Hand me the sodium hypochlorite," don't go, "You mean the bleach?" Just know that that's what he's wanting, okay? Because sodium hypochlorite is a fancy word for household bleach. All right. So then he'll irrigate with the sodium hypochlorite. And then he's going to go to rotary files. And those are files that will go inside a handpiece. And he will sit there and he will shape and clean the canals. And again, it goes in 5 increments, 20, 25, 30, okay, for the width. And it would be a 21 length or a 25 length. If he stops at a 21 length at a 45 width, then that is what he is going to seal the canals up with gutta percha. And I'm getting ahead of myself. I'll show y'all what gutta percha is here in a minute. If y'all notice on 419, there's a ruler. So, and below are the hand files, those K files, and it's got a little rubber stopper. So what he'll do is he'll take that file and he'll go as far down as he can, and then that rubber stopper will stop him from going too far. And then he's going to use that ruler and measure exactly how long the canal is. And that's when he'll call out numbers to you to write down. Excuse me. Turn to page 420. Up at the top, if you see where it says extra fine, fine, coarse, medium, those are known as paper points. And they are thinly rolled up little pieces of paper. So once he cleans out all the infection, then he'll irrigate with the sodium hypochlorite. Then he's going to dry the canals with these paper points. So he might go through 1 package or 2. He'll dry the canals out. And then he's actually ready to seal. And if you notice at the top of 420, the pink, it kind of looks orange or pink. That's known as gutta percha. It is they're a rubber material made from a gutta tree. I've never seen a gutta tree, but that's what they're made from. So the gutta percha actually is melted, and then it gets melted into the canals and seals up the canals. And that's known as arbitration. So, like I said, you basically are sitting there. He's doing all the work. You do have to do some things, but a lot of times he's doing all the work for during the root canal. underneath the gutta percha, there's that gun. That gun is almost like a hot glue gun. It has gutta percha in the gun, so they just stick that into the canals and pull the trigger. But it's the same concept. So a pulpotomy is for kids. It's a baby root canal. Now, I don't know if y'all have ever seen a baby tooth. They don't have long roots like we do. Okay, theirs are very short, and they're not actually formed like an adult tooth would be. But they do have a pulp. The baby teeth do have a pulp. Uh, it looks like a little red boogie. That's what I think it looks like. So they do baby root canals, which are called pulpotomies on baby teeth. Pulpectomy, that's for adults. That is our root canal, removing our pulp from adult teeth, from permanent teeth. All right, turn the page. So the isolation and disinfecting, most dentists will use the rubber dam. It's that piece of rubber that goes over the mouth. We call it a little raincoat for the tooth. That way, when he's using those files in the mouth, if one slipped out of his hand, he has the rubber dam on, and it won't go to the back of the throat. So we did talk about working length. Because I do have my trusty tooth here. Yay. So when they're doing the root canal, they want to make sure that they get a good working length, because they need to be 2 millimeters from the apex. Remember, the apex is the tapered end of the root tip. They have to be 2 millimeters away. So if they're, imagine this is my gutta percha. If you notice, if he sealed it up with gutta percha right there, that's more like 4 millimeters. So that root canal would fail. Sometimes, if he's filing and he files too much, he can blow it out the end of the apex. And so when you take an x-ray, it would look, the gutta percha would be coming out the end. And that's definitely not what you want. No. Actually, some people, most of the time, if it accidentally happens, the body will absorb it. If it doesn't, it will form like an abscess. And so the dentist literally will have to go and do what's called an apicoectomy, where he flaps the gum down, drills through the bone, drills a hole through the bone, cuts off the end of the apex, and then seals it. And that's called an apicoectomy. But not often does that happen. So that machine on the top of 422, that's called an apex locator. And so you see where it has a little hook, like a fishing hook? That hooks into the cheek of the patient. And then he puts his file on the other end, and it beeps at him, and it tells him exactly how long the canal is, and that's called an apex locator. So the purpose of debridement and shaping of the canal are use specific shapes. It removes the bacteria, smooths and shapes the canal, and gets it ready for the seal with the gutta percha. And after the canals have been debrided and everything, the shape and the size, and they sealed it with the gutta percha, that's known as obturation, where they seal the root canal. That's known as obturation. Any questions? Well, I guess if you have any questions, text me. Okay. And remember that any tooth that has had a root canal has to have a crown. Has to have a crown because it's like our bones. If our bones don't have calcium, they become brittle and they break. Same with the tooth. We've taken the pulp. We've taken the blood, that nerve supply from the tooth. So it will over time become brittle. So that's why every single tooth that has had a root canal has to get a crown. Okay? And give it that extra strength, that extra support. So, all right. Well, I will talk to you guys soon. Bye.